asked her prior to treatment. And what we're doing at this point, very light hands. Very light hands. We're talking a nickel's worth of pressure. Minimal pressure. And what you're doing at this point is you're feeling for any sort of fascial give. Just by having your hands here, you're going to create enough heat that you're going to start breaking up some of the hydrogen bonds within the fascia, and you're going to get a myofascial release. So by doing nothing, you're doing something. Okay? So this alone is going to help people. But what I'm feeling with Brandy is that she has a fascial pull this way. So her body wants to go like this. So this anomament is anteriorized, this one is posteriorized. So what all I'm doing, again, coming off the pubic bone, thumbs pointing up, waiting, waiting. And once you start getting the fascial give, it's going to feel like it's going to start dancing under your hands. So she wants to pull up and over this way. And all I want you guys to do at this point is just feel it. Don't take it in any direction, don't resist it in any direction, just feel it. It's going to dance under your hands, let it go. And some people can take a while. Brandy's got some longer stuff going on. Now it's starting to pull back towards her right. So essentially what my hand has done is it's gone up and over, and now it's coming back and down. It's a very exaggerated movement of what's going on. That's what's going on here. Okay? Pelvic diaphragm. Respiratory diaphragm. There's two different ways you can approach this. I have old hands. I've been doing this for over 10 years. So my hands don't like this very much. As long as your hands are essentially on the placement, I'm never going to tell you to do something that's uncomfortable, okay? The superior hand, your hand on top, needs to be in the epigastric region. So you find the xiphoid process and you make sure that your hands are in contact with the xiphoid process and in the epigastric region. Easy enough, right? Hand goes underneath. So my hand underneath is essentially doing one of these because the respiratory diaphragm is large, correct? So we want to cover a fair bit of anatomy with this hand. We're covering the lower intercostals and the TL junction all at the same time, okay? So this is essentially what my hand is doing in the back. So your hands can do this, and you can do the same thing. Again, make sure that the edge of your hand is in contact with the epigastric region, and you're just waiting. I don't like doing that, so I just modify it slightly. I'm still in the same area, it's just I don't have the torque through my wrist. And same thing. Everything wants to pull and come down this way through the respiratory diaphragm. Very light pressure. You can attest to how much pressure I feel.
It's just a hand placement.
And even then, if you don't feel it moving, don't push harder. Come off lighter. She started responding even more to a lighter pressure.
I'm sensitive soul. Delicate flower, right?
The hand placement for the STA is the same. We're talking upper dorsals through here, lower cervical spine, and we're just holding. And then placement for the anterior hand is right across the sternoclavicular junction. Don't put your hand on their throat, okay? They're not going to like it. OA in the base of our hand, and gently with this one, folks. Again, you're touching somebody's throat. If somebody's uncomfortable with this, don't do it, okay? It's not mandatory, don't do it. So hand cups the base of the skull, and then with your thumb and your first finger, you come in and very gently come into the hyoid. And you can tell if you're on the hyoid. Can you move your tongue from side to side? Perfect. Relax. Have them move their tongue from side to side. You're going to feel it shift when you have them do that. You'll feel it come out into your fingers, and that's when you know you're on the hyoid. Don't pinch the hyoid. We're just holding it. Brandy's wants to come forward. So again, I'm jumping through this process very quickly. This whole process can take you upwards of an hour. I've had some people where I've had to hold on to a diaphragm for like 15 minutes. It takes a while.
That was just feeling like for 15 minutes.
That was for a release.
I think that's the formal hyoid muscle going to the shoulder.
Yes, very good. Yeah, that's the correlation between, say somebody has jaw pain, and it doesn't matter what you do, you can't get rid of it, check their ulnar hyoid. If somebody has a pull and their shoulder continually comes up towards their ear and their head tilts, check their ulnar hyoid, okay? And then from here, you already, so this one's a little bit different. We'll get into sphenoid later, so we'll get into that diagram a little bit later, but not right now. It's a little bit more advanced. What we're doing is you're coming under, and all I want you to do at this point is just hold their cranial base. Make sure your fingertips are right on the joint line, okay? So come under, gently come in, and all I want you to do is just palpate and just feel what it says. Listen to what it tells you. I don't mean that in some sort of esoteric way, just palpate the tissue. You should have enough palpation under your belt at this point in the game that you're going to understand what it's telling you. So on Brandy's right side, she has a ton of tension right at the foraminifera. So if I were to come in and palpate through C1 in the OA, so that tells you a ton of stuff from there. Just releasing this diaphragm, you're going to help release the OA, you're going to help release the jaw tension that she has, and she's in flexion. Sort of flexion. Okay? So you're going to help with that, just by simply holding, waiting for the myofascial release. Okay? Again, to their pubic bone, and then place your hand, thumbs point up. Okay? Respiratory diaphragm, same thing. Just make sure this hand is in the epigastric region, and you're covering the TL junction in the back. You want to make sure that these fingers, however many, 1 or 2, are on your floating ribs. Okay? Come up to the STA, same thing. Hand goes on the sternoclavicular junction across here. Don't put your hand on their throat, they won't be happy. Posterior hand covers the upper dorsals. Hyoid, you come in, you hold the OA, you palpate the hyoid, you have them move their tongue from side to side, make sure that you're on it, and just wait for it to go. Go into the OA, just palpate, make sure you're on the joint line, and wait. Okay? Good, let's go.
Let's do?
Yes.
It's very interesting dancing.
Yeah.
Is that also like tingling?
Pelvic bone is like here.
What?
Just in the very case, right as I put process and Christmas.
Yeah, she's coming.
Actually, we should all drop off our info to each other after, because like I took videos and
Yeah.
stuff, so
Oh, you do?
I'll make sure I send it. I'll put it on Google Drive.
Oh, yeah. Sorry,
Is this pressure?
No, it's not.
Like I could feel my skin going that way. But, no, go ahead.
Head extension.
My right.
Did you want me to pull my shades up?
So here we also get
My lower.
part of the rotation.
Some pulling going.
Oh, really?
So keep in mind what you're palpating through. Keep in mind what you palpate through the pelvic diaphragm, and make a mental note of the line of force that's being pulled through the body as you're working these diaphragms, okay? It's pertinent to how you treat your patient in the long run.
So you feel them here affecting.
Yes, absolutely. Because everybody has a different line of tension, right? Like just looking at him lay, you can tell that his head's rotated that way. So where's it coming from along the process?
Garrett, you want to be on